Every single night, our bodies run complex, unconscious maintenance routines to keep us alive and repair our tissues. A slightly damp pillow once in a while is a normal byproduct of deep sleep. But when you find a pool of saliva on your pillow every single morning, you are looking at a mechanical override. Your body is physically blocked from completing its normal cycles. You face a distinct choice here. You can dismiss the damp pillow as an embarrassing quirk and wash the cases more often, or you can use it as an objective prompt to make a targeted diagnostic investment. To decide which path to take, we have to establish a baseline. We need to separate harmless sleeping habits from actual clinical signals. Look at this sleep saliva baseline scorecard. The left column outlines the criteria for harmless drooling. If it happens infrequently, you naturally sleep on your side, and you wake up feeling completely fine with zero daytime symptoms, no medical action is required. But notice the clinical signal column on the right. If the drooling is a daily, persistent occurrence, if saliva is actively pooling, and if you wake up dealing with physical pain or lingering fatigue, you have crossed the threshold. Ignoring this clinical signal means leaving the underlying trigger unresolved. Systemic issues or chronic oxygen deprivation will quietly compound over time if left unchecked. Recognizing this distinction early is the vital first step to avoiding complex, expensive medical interventions years down the line. We can map out what goes wrong beneath the surface using this drool diagnostic tree, starting with the first branch, the airway and breathing system. When sleep apnea partially or fully collapses the airway, the body forces the mouth open to pull in air, bypassing the swallowing reflex and leaving saliva nowhere to go. A forced open mouth breathing pattern is a physical struggle for oxygen. The resulting drool is simply gravity taking over an open jaw. You can confirm an airway blockage is the root cause if the drooling is accompanied by chronic snoring, waking up with morning headaches, or a feeling of profound exhaustion despite being in bed for 8 hours. You will see the exact same survival response if your nasal passages are blocked by seasonal allergies, hay fever, or chronic sinusitis. The nose clogs, the mouth opens, the swallowing stops, and the pillow gets wet. Investing in a sleep study or committing to a strict allergy protocol requires time and money up front, but doing so restores nighttime oxygen flow and prevents the severe cardiovascular damage associated with long-term apnea. Shifting our diagnostic tree away from the airway, the second major branch illuminates the digestion and gut system. When stomach acid rises into the esophagus during sleep, known as GERD, the body produces excess saliva to neutralize the acid. You can confirm GERD is the driver if you wake up with a better taste, chronic cough, or chest burning. Then there is the hidden gut trigger, intestinal parasites. When these organisms inhabit the digestive tract, they act as a persistent irritant, triggering a continuous immune response that strains the entire system. Parasites follow a distinct circadian rhythm, reaching peak activity in the gut between 10 p.m. and 2 a.m. This timing forces an artificial spike in saliva production, right in the middle of your deepest sleep hours. The secondary symptoms to watch for here are unconscious teeth grinding during sleep and localized anal itching during the night. Parasitic testing and strict dietary changes are uncomfortable trade-offs.
However, they directly address the source of that constant internal irritation, halting hidden digestive damage and the resulting systemic inflammation. Moving down the diagnostic tree, we find the third branch, structural and acute issues. Physical dental problems prevent the mouth from closing properly. If you have jaw misalignment, poorly fitting dentures, or severe tooth decay, your jaw rests slightly open and gravity pulls the saliva out. To make matters worse, active dental pain causes the body to ramp up saliva production to protect the affected tissue, compounding the physical leakage. Acute throat infections like tonsillitis or pharyngitis act as another localized trigger. As the immune system fights the infection, it floods the irritated mucous membranes with extra saliva to flush out pathogens. A sleeping person simply cannot swallow fast enough to keep up with this immune response. Paying out of pocket for a dental realignment or treating the underlying throat infection provides an immediate return on investment. It resolves the localized pain and physically seals the saliva leak. The final diagnostic category involves systemic changes and chemical inputs that affect the brain and nervous system directly. These prescription medication bottles represent a common chemical trigger. Certain categories of drugs, specifically antidepressants, antipsychotics, and Parkinson's medications, chemically force the body to produce excess saliva. During the day, you automatically swallow this excess without thinking, but during deep sleep, the swallowing reflex slows down drastically. The chemically induced saliva accumulates and flows out onto the pillow.
Beyond external chemicals, early-stage neurological conditions like Parkinson's disease or the aftermath of a stroke specifically attack muscle coordination. As subtle muscle control in the throat degrades, the body loses the mechanical ability to efficiently manage and swallow saliva while unconscious. Scheduling a complex neurological consult or asking your doctor to adjust psychiatric medications is a heavy burden. But catching severe systemic degradation at its earliest observable stage gives you the best possible leverage for treatment. To translate all of this into an actionable plan, we use this next steps matrix. It maps your specific viewer profile and suspected trigger directly to the required investment you need to make. Look at the first row. If your drooling is paired with morning headaches and exhaustion, you fit the fatigued snorer profile. Your trigger is the airway, and your required investment is booking a consultation with a sleep doctor or an ENT. On the second row, if your sleep quality is fine, but you wake up with a bitter taste or grind your teeth, you fit the gut optimizer profile. Your trigger is digestion, and your next step is scheduling GI testing with a gastroenterologist. To make this matrix work, you have to gather accurate data on your own body. You must commit to tracking your nighttime and morning symptoms in a journal for 3 to 5 days. This active symptom tracking isolates your exact secondary triggers. Spiraling into anxiety over a list of 8 possible medical conditions solves nothing. Methodically mapping your secondary symptoms gives you a precise, solvable diagnostic roadmap. A damp pillow is not a shameful secret. It is an objective, highly useful data point. Use it to map exactly where your body systems are failing and take the necessary steps to fix them.